Wellness for Life is brought to you by Perham Physical Therapy, Sanford Health Clinic and Same Day Surgery Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership.
Hi, I'm Don Perrin. This is Jenny Field. We're pharmacists at Pelican Drug in Pelican Rapids. Today we're going to talk about when drugs deplete nutrients. Medications can be life-saving, but take heed, they can also rob your body of nutrients you need. Nutrient loss can happen in many ways. For example, a medication may depress your appetite, which means you may not eat enough to stay nourished. It may increase your desire for less healthy foods, such as lots of sugar, bread, or pasta. It also can reduce absorption of certain nutrients in the gut, especially in seniors. It can block a nutrient's effects at the level of the cell, and it can increase loss of nutrients through your urinary system. Symptoms of nutrient loss may come on gradually and look a lot like symptoms of aging, disease, or changes in mood. So it's easy to get caught off guard. For example, pain, numbness, or tingling in legs may be a vitamin B12 deficiency, or a magnesium deficiency may cause muscle pain and stiffness. Over time, this deficiency may even contribute to bone disease like osteoporosis.
So which drugs are the most common culprits? Here's a brief summary for you. Acid blockers are one common type of medication that can cause nutrient depletion. If you have heartburn, reflux, or peptic ulcers, your doctor may prescribe an antacid, H2 blocker, or proton pump inhibitor. Studies show these drugs may cause many nutrient deficiencies. They can interfere with the breakdown of food or absorption of nutrients. You may lack vitamin B12, calcium, vitamin D, folic acid, chromium, iron, zinc, and phosphorus. Antibiotics are another type of medication that cause nutrient depletions. These can rob your body of the good bacteria in your digestive system. So for these reasons, it may be a good idea to take a B-complex vitamin or a multivitamin that contains B vitamins, as well as magnesium, calcium, and potassium. You might also consider probiotics and vitamin K normally made by those friendly bacteria. Anticonvulsants used for seizures can also cause vitamin D deficiency. Another type are antihypertensives used to treat blood pressure. Diuretics are great at helping to prevent heart attacks in high-risk people, but they may deplete magnesium, sodium, potassium, zinc, pyridoxine, thiamine, and ascorbic acid or vitamin C. Beta blockers are also great at lowering blood pressure. However, they can deplete CoQ10, and this can be very dangerous. The heart needs a rich supply of this nutrient for the energy factories in all of its cells. Cholesterol-lowering drugs also deplete nutrients. And when it comes to high cholesterol, statins are practically a household name, and that's because doctors widely prescribe them. But statins also deplete CoQ10. Hypoglycemics are used to treat diabetes, and drugs like metformin help make insulin work better in people with diabetes, but they can reduce levels of B12 by half, and they can also deplete folic acid and CoQ10. Hormone replacement therapy is used for menopausal symptoms. Hormone replacement therapy may deplete vitamins B6 and B12, as well as folic acid and magnesium, critical for not only heart health, but also mood. So if you're still moody after hormone replacement therapy, a supplement might make more sense than an antidepressant. Nearly 50% of Americans regularly take prescription drugs, and medication-related loss of nutrients is more common than many realize. Just to be safe, let's look over your list of medications and make sure you're not coming up short.
So if you're having any concerns about the medications you're on, please feel free to come in and talk with Jenny and I, and we'll see what we can do to help you out.
Coming up on Wellness for Life.
Hi, this is Amy Lundberg with Fitness for the Soul television, and I'm so excited about this show because I'm going to share something with you that I see a tremendous need for, and I'm hoping this will help you. I'm hoping you'll get a tidbit out of this show that you can actually use and be effective and make a difference for you. And one of the things I'm going to do is talk about is thyroid, support, strategies, and solutions. And so first of all, I'm going to share with you that there are 20 common patterns for thyroid dysfunction, imbalance, 20 of them, believe it or not. And I've listed the top 8, the most common 8. Primary hypothyroidism, pituitary and hypothalamic hyperthyroid, autoimmune thyroiditis, thyroid underconversion, that's low T3, increased thyroid binding globulin, thyroid overconversion, decreased thyroid binding globulin, and thyroid receptor resistance. And this one I see a lot when they take the test, everything comes out normal, and they're not quite figuring out what it is. But their thyroid is a receptor resistance to the thyroid hormone. And it's very common and frequently overlooked by thyroid symptoms. So many people have perfectly normal lab tests, yet continue to experience thyroid symptoms, low thyroid function. So Dr. Rita Marie states most doctors dismiss them as thyroid patients and simply focus on giving medications for the individual symptoms, such as antidepressants, laxatives, weight loss drugs, skin cream, and the like. So one thing is to maybe look at that, maybe have all your lab work done, all the thyroid tests. In previous shows, I've listed all the thyroid tests to take. Have them done and see what comes, because it just might be that you've got the receptor resistance. The next one I kind of want to mention and talk about is the most common is primary hypothyroid. This thyroid itself is unable to make sufficient hormones, and the causes is possible radiation and environmental exposures. And listening to other doctors and listening to conferences and going to different conferences, one of the things that I think is why thyroid is keeping up, and it's one of the gradual increase in cancers, is thyroid cancer. It's not necessarily breast cancer, but it's actually thyroid cancer, stated by Dr. Christensen. So out of integrativenutrition.com. And so many people aren't aware of all the exposure. And so when I would say 90% to 95% of all my clientele, I look at their thyroid, and if they don't have all the tests, I ask them to ask their doctor if they'd be willing to give all the tests, because we really need to know what's going on and which thyroid problem is going on, which pattern they have, so that we can help work on the different organs and glands that are in dysfunction and need to get healthier, so they can help support the thyroid. Exposure to fluoride. Kind of get off your toothpaste, guys, and see if there's an organic toothpaste, something that can be beneficial. But fluoride mimics thyroxine, and so does chlorine. So get off your tap water and move to filtered water and bromamine. Medications, big thing, talk to your doctor. Pharmacist. Your pharmacist will know the medications you're on if they are causing a factor with the thyroid. Infections and insufficient nutrients needed to make thyroid hormone, huge. Lab tests, high TSH, and then low to normal T4. So check that out. Some things that you can do is check your iodine, see if not, maybe just incorporate sea vegetables into your diet. Easy way to get iodine in. Look and get more sufficient protein. And then the zinc, selenium also is key here for hypothyroidism. Copper, magnesium, all of this in your omega 3 to 6. So you really want to take a look at some of the things that you can do here. And turmeric is also really good. Cayenne pepper and pepper also is warming. If you go more more Chinese medicine, they will say use warming foods, and that is warming foods. So those are a couple options also to different spices to use to help you. This is Amy Lundberg giving you a little info on thyroid and how you can maybe incorporate some things yourself and be self-empowered to help you get your thyroid healthier. Also, if you are interested in learning more of what you can do for your thyroid, come in for a complimentary discovery session. For those that are really committed and wanting to get healthier, for those that are on medications or have thyroid symptoms and you're just not feeling right, the health coach and what the services I offer, my clients have found very beneficial in helping them over the hump and feeling and getting back to themselves. So check out the discovery session. It's complimentary, and I invite you to give it a try if you're serious about getting better. Take care, everyone. Bye-bye.
Thank you for watching Wellness for Life, brought to you by Physical Therapy. Sanford Health, Clinic and Same Day Surgery Center. Amy Lundberg, Fitness for the Soul. Gothenburg Chiropractic Clinic. Pelican Drug Health Mart. Mojave Ottawa Community Action Partnership.